the greatest things about my job is autonomy. It's really nice coming to work and being able to work in a whole lot of different areas with patients with different health needs. Yeah, it's really good knowing that no 2 days are the same. The clinic's a nurse-led model. We're the first responders and on the front line for patient assessment. So the decisions I make every day, they have an impact on people's health, and that's a really great feeling. From the beginning of the day to the end of the day, we're making our own decisions and we don't have to chase up after doctors.
We do have 2 areas to this building. This is a primary health and the other side's a subacute area. We're the only prison in the state so far to have subacute beds run by Correctional. So working in this environment, it's varied. There's always something different happening. There's always different challenges to face, and it's also working autonomously that the staff here have got that independence and can make those decisions. Correctional strongly support professional development, and we've had staff from here go and do many courses. We do our mandatory online learning, so there is a lot of support for professional development. There's opportunities to do little portfolios, so if a nurse has got a specific interest, we can utilise that interest for the care of our prisoners here. The concerns that people do have are it's not safe, but we do have officers that are in the medical centre, so if a nurse has a prisoner in a room with them, there's an officer walking up and down the corridor keeping an eye on that. And it's definitely safer than any A&E department. We do have security here all the time, and we have personal duress alarms, so if we're feeling unsafe in any way, we just press that duress and we've got help within seconds. Staff retention here is really good. We have a lot of staff here that have been here for many years. They're highly skilled staff, which is fantastic. It's a great place to work. It's bright, great team, great officers. It's a friendly, very supportive environment to work in. And we're here for the best healthcare for our patients.
Correctional Australasia is Australia's only private healthcare provider specialising in the care of people in restrictive environments, so correctional centres, prisons, transition centres. We've been doing this for about 18 years. We have a nurse-led model. We employ lots of different healthcare professionals, but it's a nurse-led model. We're extremely proud of the people we have working for us. Overall, we seek to provide healthcare without judgment, and that means that someone who comes to a health centre within one of our prisons gets the care they need for what they've come for, rather than who they are or what they might have done. As an organisation, we encompass the values accept, so we strive for accountability in all that we do and all our staff, for continuous improvement. We look for commitment, and we look to give commitment and receive commitment from the people that we work with and those we engage with. We try to provide excellence in everything that we do. We look for professionalism in all the staff that we employ and the people we work with, all embraced in an environment of teamwork.
Our motto is healthcare without judgment, and we really believe in it. I think though you're incarcerated, you don't lose the right to basic healthcare. The prisoner population traditionally is a population that doesn't access conventional healthcare services. As a consequence, they tend to have a higher burden of complex chronic healthcare diseases and requirements. But ultimately, when you are consulting with a prisoner as a patient, the healthcare delivery and the healthcare needs and the way you go about it is the same whether it's in or outside prison. Any opportunity you have to intervene and improve the health status of a prisoner improves not only the welfare of that prisoner, but also the wider community when they come out of the prison environment. I think it's a great opportunity to work in an interesting environment with a population that you wouldn't work with otherwise. And the skills that you develop will make you a better health practitioner. The correctional healthcare environment is a very well-resourced healthcare environment, and there's a great deal of multidisciplinary staff support. So you're supported by dentists, podiatrists, physiotherapists, optometrists, healthcare promotions officer, as well as lots of nursing staff. So you're never alone in doing the job. And It's a very secure environment to work. In a lot of ways, I find healthcare delivery in the correctional environment to be more secure and more safe than many general practice and emergency medicine environments that I've worked in previously. I do like working for Correct Care. They're a responsive, inclusive, collaborative employer who really values employee wellbeing and is very proactive in that space as well.
Healthcare without judgment is what underpins us, and I think you can't work in this environment if you're a judgmental person. You need to be able, focus on the health needs of the clients, and that's what we do, and I think we do a fantastic job at it.
The work here is challenging, but the thing that I like most about this job is that I see a very diverse range of patients who have not had a lot of dental care before they were incarcerated. So it gives me an immense sense of satisfaction when I'm able to help them getting rid of the pain, more importantly, educating them about the oral health. And I've noticed as we keep seeing them every 6 months, they do get motivated to look after their teeth and follow all the oral hygiene procedures that we explain to them. The good thing is that all the equipment that we have is state of art. We have the latest chairs, we have the little x-ray machines, and we get access to all the latest materials that we can. I've worked as a dentist in corrections for past 6 years. We work in a medical center, we work as a team, we have dentists, doctors, nurses on board. We work together, we help each other. If a patient has complicated problems, the doctors are on the board, the nurses are on the board. So it's quite a good working environment, and you grow and you learn a lot from this.
As a mental health nurse, we do mental state examinations and at-risk assessments when every prisoner is recepted into the prison here. We also do mental state examinations of the rest of the population and any at-risk referrals we might get from that community. Ours, we've got a captive audience. We know where they are, we know what time, how long they're in prison for, what unit they are. We can follow them up, and we can actually pop out through the prison as we do during the day, and you see them not just in an interview, you see them out there and how they interact with others. So you get a balance of what you're seeing, not just the interview. Compliance with medication is another thing that's easily managed here, because the nurses and the pharmacy techs go out and they're very good at saying such and such is not having his medication at this time. There's a bit of working together here, and I think it's a lot better than in the community where you couldn't be guaranteed that you'll be seeing them next month or next week, or even if they'll turn up or where you find them. I don't have a problem like that. I know where they are. It's actually good to see somebody that has come into prison, has got a whole lot of problems, be they mental health, social, drugs, alcohol, whatever. And during that course of time, you're able to work through some of their problems so that they've got some skills that they can take back with them to the community, link them into area mental health, and hopefully they can go back to their families and do something with their lives rather than come to prison.
So as a pharmacy tech, we administer medication to the prisoners. We grab our order that comes in every day and pop it in the trolley, take it around to their respective units. Any orders from the doctors that have been changed with their medication, we deal with all that as well. When we take our medication around, we've always got an officer with us, so we're always safe. Yeah, we don't really have much downtime, which is good, but yeah, it keeps us very, very busy. It is a very supportive work environment. We get support from the officer side of things, and our company, they're very good to support us in any way, shape or form. It is a good career. I really, really enjoy it. Coming from a normal pharmacy to pharmacy out here, it's completely different, but yeah, I love it. I wouldn't go back. Yeah, I definitely recommend it. It's definitely not the end of my career, it's just the beginning.